Welcome back. Right here in Connecticut at the UConn Health Center, they have come up with new technology that allows patients to store frozen eggs instead of embryos, thus eliminating some religious and ethical concerns. And this research has been or was conducted by Dr. Claudio Benadiva and Linda Siano from the Center for Advanced Reproductive Services at the UConn Health Center. They join me now to talk more about this. Really a breakthrough, right, in medicine, would you say?
Yeah, this has been really a breakthrough for the past three or 4 years in general all over the world in our field, being able to freeze eggs. Now, just for people to understand, because a lot of times people get mixed up between freezing embryos and freezing eggs. So
break it down for us, because right now we're talking about egg freezing.
Exactly. We have been able to freeze embryos for many years successfully. Embryo is a fertilized egg. The eggs before fertilization, that's what is new. For many years, freezing embryos has been easy, and basically we put them in a machine that slowly cools them down, brings them to freezing temperature, and that has not been a challenge. That does not work well for the eggs.
Okay.
Now,
go ahead.
This new technique is called vitrification. It's a very rapid freezing of the eggs by removing the water, dehydrating the eggs, and freezing them very quickly. It requires a lot of skills from the embryologist to do it well.
Linda, talk about how this is different from embryo freezing, and is it better, would you say?
It's a different technique.
Okay.
And like Dr. Benadiva was saying, it's a fast freeze. It's like freeze drying something. And I believe that you have a video and you will be able to see that. But the success rates for freezing eggs were not as good doing it by the slow freeze, like Dr. Benadiva was saying. But this fast freeze has enabled the pregnancy rates to just jump way ahead.
Who are good candidates for this?
Well, this study was initially started from my perspective. We were trying to have a successful program to offer this to cancer patients. And since the health center has a cancer center, I thought that we should be able to have the option, you know, for these young women who are single and are going to go through cancer therapy, and this may affect their future fertility, that we could offer this to them. It would be for patients with other medical reasons, for patients that want to do IVF but they don't want to freeze embryos for ethical or religious reasons. Now they can just freeze their eggs. And eventually to have a donor bank, just like a sperm bank.
And this has been very successful. Numerous babies have been born through this process, correct?
We have total of 6 babies already born. One of our concerns was when we freeze the eggs, if these patients are going to come back 5-6 years later to use them, and we are not able to tell them what the success is until they come back. So by doing this study, we have been able to get results very quickly. And now we can tell our patients, I feel more comfortable telling them, yes, if we freeze your eggs, this is what you can expect when you come back in the future to utilize them.
6 babies, you said, and I read 900 internationally, so this
approximately,
is
that's what we estimate.
Well, thank you so much for coming on the show.
Thank you.
We appreciate all the work
you're doing. Having us.
And for more information on egg freezing, you can head to our website, ctnow.com.